The coronavirus pandemic has left many countries around the world desperately seeking a cure or a vaccine to curb the spread of the virus. Senior health experts in India feel that in a densely populated country like ours, it needs an individualized approach. This means ending the lockdown so that herd immunity can be developed. This immunity is an indirect protection from infectious diseases which has worked well during pandemics like measles, H1N1, influenza, etc., where some people were affected while others became immune to it. Sweden has successfully adopted this method for COVID. In Sweden, till date, there have been more than 22,000 COVID-19 affected patients out of a 10 million population and more than 2,600 deaths. However, the country has no stringent lockdown and their COVID-19 graph is showing a downturn.
I think in many ways Sweden represents a future model of, if we wish to get back to a society in which we don't have lockdowns, then society may need to adapt for a medium or potentially a longer period of time. And I think maybe in Sweden they're looking at how that is done in real time. So I think there may be lessons to be learned from our colleagues in Sweden.
Experts say that even in India, many who tested positive for the virus were asymptomatic, which might be an indication of herd immunity developing. A stringent lockdown in the country will not allow herd immunity to develop in India, and the fear is being touted by other COVID-19 affected nations like USA, China, Europe, and even the World Health Organization has warned about a second wave of COVID-19 outbreak soon. Doctors say that if herd immunity is not developed in India, this second wave will spell disaster. A senior doctor says that the coronavirus is here to stay and our only solution is to develop herd immunity. Moreover, herd immunity is more likely to work in our country because 90% of our population is under 60 and herd immunity works best with younger population. Such an exercise was adopted in the influenza outbreak in 1918. Researchers at the time found that if nearly 33 to 44% of the actual population was exposed to the influenza virus, the remaining 67 to 56% developed herd immunity. This means the influenza virus could affect only a certain percentage of the population and not everyone. Doctors believe that the government has achieved an excellent control over community spread and kept the situation under control with the extended lockdown. But when the lockdown is lifted, advice of medical experts must be considered to avoid a further surge in cases. Stay tuned for more updates. Till then, stay home and stay safe. Subscribe to Midday India. Get direct notifications on all our videos by clicking on the bell icon.